The whole work requirement thing. First of all, most people who get their health insurance through Medicaid are working. I can think of many examples, but one that hits home for me is I had a conversation with the executive director of Minnesota's NAMI division. The people who are for this bill talk a lot about a young, able-bodied man sitting on a couch in the basement playing video games and I guess collecting Medicaid checks. First of all, people don't get Medicaid checks. You either get health care or you don't. And the way they're going to save $1 trillion is by not giving people the health care that they need. By definition, they are cutting Medicaid if they are counting $1 trillion of savings. But the NAMI executive director reminded me of, for example, young men with a recent severe mental illness diagnosis who is unable to work, I guess is able-bodied and that they are physically intact, but they are not able to work. So they need access to health care to stabilize their mental illness so that they then possibly can go on to work.
Exactly.
So the backwards reasoning around this is really misleading to the American people because it doesn't reflect what's actually happening on the ground.
I totally agree with that. I think there is a lot of fear mongering going on in order to get people on board. Bill has already passed now, but I think before that's what they were doing as well, was selling a false promise that this was going to be something good for the American people when in fact it is the complete opposite. And the irony is that a lot of our service members who come back from the military have complex psychological disorders such as complex PTSD, and they rely on Medicaid as well. Yeah. And Medicaid is not going to be covering behavioral health, and they're not going to be covering psychiatric and primary care. We are abandoning our Americans on multiple levels.
That's a great point. I think a lot of people don't realize that our veterans, many of our veterans do rely on Medicaid and SNAP for nutrition assistance. So we are just cutting people off at the knees. And for what? I keep coming back to for what? The whole reason we're talking about this is to pay for tax cuts for the wealthiest Americans. It's just, it's mind-boggling to me.
It is mind-boggling, especially when I learned that we're not even saving money.
Right.
We're adding $3.3 trillion to the national debt. We reallocated money to the Defense Department and for tax breaks, and we took it away from the poorest Americans.
It's the largest single transfer of wealth in the history of our country, from the poor to the richest. It's wild.